Welcome to the CSH Sustainable Kidney Care monthly webinar. Very welcome to those joining us again, and a very, very warm welcome if this is the first time joining us. We run these webinars every month. They are free. They are welcome to anybody who has an interest in sustainable kidney care, so feel free to share the invitation. What I'll do is I'll give an introduction and then I'll hand over to our speaker. So typically the format will have an expert every month who presents around 20 minutes or so of a topic of their expertise. And then there's plenty of room afterwards for discussions. So we ask if you do have questions, just save them to the end after we've done the presentation. And it is my absolute pleasure to welcome our speaker today, Dr. Tamara Glavinovic, who is a nephrologist at the University of Ottawa and has clinical focus in reproductive health in kidney disease and in quality improvement. She completed her medical degree at McGill University, followed by internal medicine training at University of Manitoba and nephrology at University of Toronto. She then completed a fellowship in glomerulonephritis at Monash Health Centre, Melbourne, Australia, along with advanced training in pregnancy and kidney disease at Sunnybrook Health Sciences Centre. She then completed a master's in public health with a focus on quality improvement, as well as a master's in clinical education through the University of Melbourne. She is involved in the Canadian Society of Nephrology in activities related to quality improvement and is vice chair of the Sustainable Nephrology Committee. She works closely with the International Society of Nephrology in developing educational materials related to obstetric nephrology. And it is our absolute pleasure to welcome you to our webinar. So I will hand over to you, Tamara.
Can everybody hear me?
We can. I'll ask if if everyone else could mute. There's a little bit of background noise. That'd be brilliant. Yes, and we can see your screen. So go ahead, Tamara.
Wonderful. Okay, so this is a fun talk to give because I get to talk about all of the great people doing interesting things across Canada. So it was sort of fun going through a lot of the material in preparing for this, actually. So I'm hoping to talk about sustainability in nephrology and really talk about what the experience has been from the Canadian side so far, and talk a little bit about the work that we have been working on as a group over here. I have no disclosures relevant to this talk. And I'm just hoping to start off with a land acknowledgement. I'm based in Ottawa in Canada, and I acknowledge this as the unceded traditional territory of the Algonquin and Anishinaabe, and the people of the Algonquin and Anishinaabe Nation, which encompass the watershed of the Kitchissippi, which was also known as the Big River, and now is commonly known as the Ottawa River. The Algonquin and Anishinaabe have been here in the watershed for thousands of years, long before European contact, and will continue to be here well into the future. We recognize all Indigenous people in the region from all nations across Canada who have also made Ottawa their home. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders past, present, and future, and dedicate ourselves to moving forward in the spirit of partnership and reconciliation. The image that you see here is actually based from the Ottawa Hospital land acknowledgement, and it's a lovely piece of art that is meant to represent medicinal plants that are passed down from generation to generation. That was based upon original birch bark cutouts that they used to make baskets out of. So with that, I'm hoping to introduce ourselves as the SNAP committee, who we are, what we do, talk a little bit about our organizational structure, and then I get to highlight some of the education-based work that's being done in Canada, talk about some of the quality improvement initiatives, both at a regional and national level, but also some of the local initiatives that are being done.
Tell you, just pitting people against each other, that's all it's doing.
And then more broadly, some of the research initiatives that are being done across the country. So really, I'm hoping to toot the horns of those who are working in this area. And maybe more importantly, my goal with giving this quick talk is to bring people together, because if even one set of people who are on this talk get to see what the other's doing and be inspired by it, if I can even make one connection between groups, I will call that a success. So who we are and what we do. So the Sustainable Nephrology Action Planning Committee is a multidisciplinary committee under the umbrella of the Canadian Society of Nephrology. And we are made up of a countrywide group of providers that are dedicated to aligning kidney care within planetary health principles, and thereby advancing patient care within a framework of environmental sustainability. Our vision is kidney and planetary health through sustainable nephrology practice. Our mission is to educate, innovate, and advocate for this sustainable kidney care. And really, our goals are to incorporate efficiencies in care pathways, advising and informing regarding environmentally preferable procurement, and that's a big one, equipment and infrastructure, and advocating for funding and policy alternatives in the provision of kidney care. These are all the fabulous people who are involved in the committee. We have 16 members, and I'm sure you'll recognize some very familiar faces. We're led by Dr. Carolyn Stigant. We have 10 nephrologists across the country, and they represent both French and English-speaking Canada across all regions. We have 2 trainee members, 1 senior nephrology technologist, a renal nurse, a renal pharmacist, and a patient partner. So a lot of fabulous insight from this group. So just a brief mention of the Canadian landscape. Canada is a large country, and unlike the NHS, where renal care and other care is provided at a countrywide level, the provision of healthcare in Canada is provincial, as I'm sure many of you know. Now, with that, we work within the constraints of our healthcare system, and then that also brings around opportunities. And so some of the provinces do also have agencies that have been created at a provincial level with a mandate to connect and coordinate renal care across the provinces. And those are really BC with BC Renal, and Ontario with Ontario Renal Network, or now called Ontario Health. Interesting about Canada is that southern provinces also provide the renal care for those living in the north, including all of the territories. So it is centralized in some ways that way. From a geographic standpoint, there are challenges, and certainly with the country being so large, we do have fairly large swaths of the country where there's no in-center hemodialysis available. Some places also having remote fly-in dialysis units. And so the bulk of people who are dependent on renal replacement therapy or kidney replacement therapy do need home modalities. So what we're working on, I'll start with health professional education and patient education, and then move on to QI, and then talk a little bit about the research that's being done. Firstly, at a national level, I wanted to talk about Cascades because I think they're a fabulous initiative that was started in 2021 between the University of Toronto, Dalhousie, the Planetary Healthcare Lab in BC, and the Canadian Coalition for Green Healthcare. They're funded by Environment and Climate Change Canada, and they have the vision and mission of a pan-Canadian health system that supports a healthy planet, is caring and equitable, and serves communities so that they thrive. They hope to support the healthcare community in making this vision a reality. And their mission is to strengthen the capacity of the healthcare community across Canada to try to transition towards that high quality, low carbon, sustainable, and climate resilient care. From a kidney standpoint, now they span multiple specialties, but from a kidney standpoint, they have created a sustainable kidney care playbook, which we are now using as an implementation tool. It's also a fabulous resource, as I've included the link down below. It's an excellent learning resource for an introduction to sustainability in kidney care, which I'm sure many of you already know about. What are we working on? Now, this is partly local, partly national. We're working separately on a lot of education and curriculum development, really to try to disseminate the knowledge, both to health professionals, but also to patients. One of the things that we've done that most recently was that we recorded through our committee members, there was about 6 of us that were included. We recorded a pre-recorded presentation on environmentally sustainable kidney care. which was meant to be an introduction for nephrology trainees, with the plan to disseminate this across Canada to program directors, both across training sites and then also to the hospitals where there isn't a training site, to Cascades, to a number of other institutions. And we're hoping to highlight this at the Canadian Society of Nephrology at the annual general meeting. Aside from that, we're working with the Royal College. Now, the Royal College is responsible for trainee accreditation and assessment in Canada. We're working on implementing sustainability-focused assessments as well as training, and we're trying to align different systems such as EPAs, Entrustable Professional Activity assessments, trainee examinations, really to include the topic of sustainability across all areas of training. Dr. Neil Finkel, who's based in Halifax, has been working very hard in that, and it's a work in progress. At a local level, just as an idea, and I'm sure many people are doing it also, but we've done at the Ottawa Hospital was we've implemented a longitudinal sustainability materials for internal medicine trainees. So when internal medicine trainees get taught by the many different subspecialists who may not have knowledge or an interest or dedicated experience in terms of sustainability, we've created a set of slides that we've incorporated into all of the lectures in hopes of making this an ever-present topic and keep it at the top of people's minds rather than dedicating just one lecture to it once every year or once every 2 years. Our pharmacists at the Ottawa Hospital have also been working hard on developing pharmacy-led counseling resources that are really aimed at patients in trying to get them to be more knowledgeable and more cognizant of what should they do about their medications to prevent heat-related acute kidney injury? What should they do about blood pressures and management on hot days? What should they do about this or that, or staying out of the heat, or staying hydrated, or whatnot? So those are work in progress again, but those are going to be resources that are going to be available online fairly shortly. What about some quality improvement initiatives? So we have quite a few things going on, which are really interesting. I'll start with the regional and the national initiatives. The first of which I'll mention is, again, you can find this online. It's called Stop Med HD, and it's a group out of University Health Network in Toronto, Canada. Forgive the typo at the end of Canada. It's led by Dr. Marissa Battistella, who is a pharmacist and researcher at the UHN. Focused on strategic optimization of prescription medication use in patients on hemodialysis, and really looking at exploring the barriers, how best to implement and figure out ways of deprescribing medications which may not necessarily be needed or necessary in patients who are on dialysis. At a provincial level, we're working also hard on developing and building organizational capacity. The framework, again, it differs between provinces. So I can speak to BC and I can speak to Ontario. And BC is really the leader in this regard. So I'll highlight that. So BC Renal has developed a strategy to integrate environmentally sustainable kidney care within all BC renal committees, which I'll highlight here on this slide. And forgive me, I realize that's a little bit blurrier than I'd hoped it would be. So they really hope to develop and disseminate a planetary health strategy to guide actions for the advancement of planetary health in BC Renal. I have a stretch goal of 40% reduction in kidney care originating greenhouse gas emissions by 2030, which is in accordance with Canada's 2030 emissions reduction plan and Clean BC. And they have a number of objectives. So the hope is that this is going to be, and the plan is that this is going to be implemented across all committees of BC Renal, that this will be implemented across all research streams, and really be made a priority across all areas. And that's related to kidney care delivery coordination, operations and procurement, capacity building, and then adaptation and resilience as a separate but very important area to focus upon. The next thing I was hoping to mention was choosing wisely. And I'm sure many of you know choosing wisely. Now, choosing wisely recommendations exist for many, many subspecialties. We on the Canadian side, myself included, have worked on just recently updating the general nephrology choosing wisely recommendations. We're working on updating the transplant ones. And choosing wisely has also come out with a climate action subset where the hope is to reduce unnecessary tests and treatments and procedures, with this being an opportunity to benefit both patients and the planet. And really, across many subspecialties, they've identified several large categories of waste, which could be cut or could be minimized without any significant impediment to providing healthcare. So we're going to be, interestingly, with nephrology being one of the areas that's quite wasteful, we don't have a nephrology one as yet, and so we're working on creating that. What about some local initiatives? So local initiatives are, a few of them are mentioned here, and forgive me, I couldn't include everything that's being done in Canada because there's quite a bit going on. I hope to highlight a few interesting things that are happening, and there are multiple groups working on similar things. But some of the interesting local initiatives do relate to the provision of hemodialysis or peritoneal dialysis. Some of the projects that are being worked on at St. Joe's Hamilton by Dr. Johanna, by myself at the Ottawa Hospital, and by Dr. Wald and Mira Shah at St. Mike's are reducing dialysate flow to 500 mils per minute in hopes of minimizing water wastage and water use with each hemodialysis session. A number of sites across Canada are starting to, or either are, or are starting to implement central acid delivery in hopes of minimizing plastic waste. So I can speak to the University of Ottawa. We use this at a majority of our sites, and we're going to be building a new hospital in the very near future with a pretty large, about 70-something chair dialysis unit, where we will be implementing central acid delivery instead of the big jugs that we traditionally use. This is also being used across a number of sites in Canada, and so many places that are thinking of refurbishing this we do have a network of people who are already working on this here, and so we'd be very open to collaborating. Another way of minimizing plastic waste that we are starting to use here at the Ottawa Hospital is, rather than using normal saline bags to prime the circuits of the hemodialysis machines, we've just put into place online priming using the dialysate in hopes of minimizing the plastic waste. Now, we still have to keep the normal saline bags in cases of emergency, but this really has minimized how much plastic we do use at our local level. Another interesting one from a medication standpoint, which is based out of BC and we hope to emulate here in Ottawa, actually, is how IV iron is administered in the hemodialysis unit. So traditionally, it's given via infusion with normal saline bags, with all the tubing that's necessary for it. But they created this fantastic protocol where, rather than using these normal saline bags, they're giving it as an IV push, which has greatly minimized plastic waste, but also resulted in cost savings that can then be used for other areas within that dialysis unit, whether it be related to projects or other initiatives from a sustainability standpoint. The last local initiative that I was hoping to mention on this slide was related to PD icodextrin solutions. And I would be very curious to hear what other people do in different countries. So here we only have 2.5 liter bags available. Whereas I understand that in Australia, they have 2 liter bags available. Now here, most people don't use 2.5 liters as their last fill during the day, which means that a substantial portion of fluid is wasted. And there's associated plastic waste with that, cost wastage with that as well. And so there's a fabulous opportunity for advocacy with our industry partners, which we are just starting to embark upon. And again, if anyone has any insight for that, we would very much welcome it. A few other local initiatives, which I'm hoping to highlight. One of which was a wonderful paper written by Sarah Thomas, who's based out in BC, and it was highlighting nursing initiatives to reduce plastic waste and really to encourage nurses as the ones that are the frontline health professionals involved in providing patient care, who will see much of what is being done or what isn't being done. And it provides a lovely framework to try to audit what is being wasted and ways in which that can then be adapted. The next, I think, really lovely initiative is also the reduction of what we traditionally call monthly blood work, which in our center used to be done every 4 weeks. We have reduced it a few years ago to every 6 weeks. And this was originally published by Sam Silver, who's based out of Kingston in Canada, when he was in Toronto, looking at exactly this, reducing monthly blood work to every 6 weeks. Not only from a sustainability standpoint, but from a monthly blood work burden, from a health professional burden perspective, and it didn't show any difference in health outcomes for patients. So we've adopted this here. The last one that I think is really great, and it's actually being worked on in multiple different areas, is the provision of incremental dialysis. Now, incremental dialysis is when we don't start people off on thrice weekly dialysis off the hop when they do start dialysis with, for example, advanced CKD, but we try to tailor it to their residual kidney function. And so from a Canadian standpoint, we're involved in a few different ways. The Alberta group, working also with the BC group, has recently published an implementation protocol where they focus on personalizing hemodialysis treatment for people who have just started hemodialysis, which was published in BMJ Open recently. We're also part of a multinational study called INCH-HD, which is actually Australia-led by Dr. Peter Kerr, who's based out in Monash. But there is significant Canadian and Australian and New Zealand participation in this to see if there are any differences from a patient standpoint, from a health outcome standpoint, with incremental dialysis being prescribed. Now let's talk about sustainability research. There are a number of really interesting initiatives happening across Canada. And I'll talk about the first one. So the first one is led by Dr. Isabelle Etier, who's based out of the University of Montreal in Quebec. And Dr. Etier is focusing on a qualitative research agenda. Recently published a survey of sustainable kidney care knowledge, attitudes, and practices amongst kidney care providers across Canada. What she found, along with the rest of the authors, was that most kidney care providers who answered the survey were informed, were concerned about climate change, and their knowledge was directly associated with attitudes and practice. And so with that, of the people who responded, appreciating that that's a limitation, that educational initiatives to increase awareness and knowledge on climate change can and certainly will lead to practice changes. And so with the limitation that those people who answered the survey may be a certain subset, the fact that those people are interested, engaged, have knowledge, and are keen to change shows that there's actually a number of people who are interested in this area who can make a pretty substantial difference. Dr. Etier is also working on the important patient perspective part of this, actually, so that we certainly don't miss this as a gap in trying to develop this area to inform care as it is now, and then also to prioritize research. So we do have cross-Canada collaborators for this. We are funding submitted to the CIHR, the Canadian Institute for Health Research, with a pilot program that's ongoing right now at the University of Montreal, which includes patient focus groups. With all the mitigation, I should say, measures in place, there is also a strong need for resilience and adaptation. There are a number of Canadian examples of climate change mediated natural disasters and extreme weather events that we've seen already over the last number of years. The photos on the right are several examples. So one of which was the wildfires in northern Quebec and Chisasibi, where a number of dialysis patients had to be relocated to Montreal. And then wildfires threatening water quality in certain BC communities, a number of relocations that have to happen, and then emergency preparedness is starting to become a big challenge. With that, Dr. Sandel, based out of McGill University, is leading a ambitious and big and important project looking at disaster risk reduction and management. And the hope is to assess vulnerability and adaptation across the provincial health systems and kidney care facilities across Canada. A second part of this will be to explore patient and caregiver and kidney care providers' experiences and perspectives if they should have experienced natural disasters in the past. And the ultimate plan for this is going to be to conduct a national consensus conference and develop national guidelines and data collection in emergency mitigation and management. So I've just linked the paper there if anyone is interested. And again, the work is ongoing. With that, I hope to mention that part of this work also includes the ability to build capacity and to adapt within kidney care. And so part of that had been looking at disaster management protocols and look to see what exists currently across Canada. From a survey that's an environmental scan that's currently in progress. Oh, forgive me, I hear a bit of an echo.
Storage with respect to.
Yeah, could I just ask if somebody doesn't have their mic muted, if they could, that'd be great. Thanks. Sorry, go ahead, Tamara. I think you're now muted, Tamara.
I hope that's better.
Yes, got you now.
So forgive me. So this was an environmental scan also led by Dr. Sandel that is soon to be published, looking at disaster management protocols across the country and looking to see how prepared are we. What we found so far is that 4 provinces have provincial documents. 6 provinces don't have either minimal or no documents whatsoever. And so this highlights a fairly large gap within this area where we do need to plan and think of both tangible and intangible resources, monetary considerations and transport, considering things such as storage, consumables, and medication, and then minimizing barriers, importantly to licensure and transportation if it comes to the point where either health professionals or patients need to be relocated between provinces for the provision of care. And maybe lastly, I'll finish off by another important ongoing work that's led by someone I think everybody knows very well, Dr. Stigant, and that's really on the topic of procurement and life cycle assessments. Dr. Stigant is involved in so many areas in this field, and one of her ongoing research interests is looking at life cycle analysis of kidney therapies. And she's been working very heavily with the ISN Green K group, developing a joint statement of demand to advocate for environmentally sustainable, low carbon and circular kidney care services. And so the procurement strategy with this joint statement of demand is really focused on enhancing ethics, reducing emissions in the supply chain by incorporating environmental sustainability and climate resiliency principles into the procurement process. And the hope, and really what we need is this formal endorsement, this statement of demand, which will be needed to bring industry on board and to locally disseminate the tool. And locally disseminate the tool maybe at a regional level or at a country level, depending on each individual's healthcare system. So I'll finish that off. I think I'm almost at 30 minutes exactly, but I'll finish that off with lessons learned within from the Canadian experience. We know we work within our existing healthcare system. We know that we're provincial, and that does come with some benefits. It also comes back with some drawbacks. We can't shift healthcare on a national level, but we can certainly do it at a provincial level, and that still affects a large number of people. So I think that's a big positive. We've learned that engaging with our network, now we have a fabulous group of individuals across the country that are very keen to collaborate. That includes Cascades, that includes our provincial partners, the ORN, BC Renal, as well as other provinces. We are working with our strengths, with all of the people working in these different areas. There's a tremendous amount of good ideas and collaborations that are coming forth. One thing that we are embarking on with the advocacy committee that was recently formed with the Canadian Society of Nephrology is that we really need to engage with industry and with funders in order to promote change. And that's also really where that joint statement of demand that Dr. Stigant is working on is going to be incredibly important. With this SNAP committee, research grows in not always linear ways, but we have a really strong research interest that has grown from the activities of the community and of the committee. And we've brought in trainee members that provide fabulous perspective. So right now we're working on maturing the committee to really develop education further, to develop QI initiatives more at a national and regional level as well as local level, and try to really focus on those that are going to be feasible, high impact, and then also cost savings for programs. And really the point of this is that we're stronger together. I sort of sound like I'm trying to channel Mark Carney with his recent speech at Davos, but the opportunity for collaborations either within our region or within our country or between countries and is really important because there are many interesting projects being worked on worldwide. We face many of the same similar problems, and I think we can come up with some interesting solutions. So I would be very happy to take any questions, and I'm keen to hear what others are working on.
That's brilliant. Thank you so much, Tamara. I am keen to open the floor to questions. Just quickly, I will say, in the spirit of your last comment on being stronger together and collaboration, I'd encourage people to check out CSH's Sustainable Kidney Care Network, which is truly global, and people post questions, resources, all sorts, and the videos for these webinars will get uploaded there as well. And also, in case people aren't familiar with it, just to echo what you're saying about the Cascade Sustainable Kidney Care Playbook and Choosing Wisely are both brilliant. So if people haven't had a chance to check those out, definitely do. And with that, I'll open the floor up to questions. Maybe if you end presentation as well, and then we can see the person who's asking. Matt, go ahead.
I'll start. One of the wonderful to hear so many different things going on. Is there anywhere that's doing everything? I often find that there are great pockets of great work spread across all over the place. And for me, one of the absolute ideals is somewhere that really is doing it all and is so far ahead, because I think sometimes it can feel overwhelming when there's so many different things that could be done. Is there anywhere that's doing everything?
You know, I don't know the answer to that. I would be willing to bet that the folks in BC are ahead of us in many regards. I would say that there's probably not one place that's doing everything. And so I think that's where, to your point about, and I hear you in terms of being overwhelmed about all the little things that can be done or quote unquote should be done or opportunities for them to be done. I think the first step is building a local working group or a local committee looking to see what are the priorities at your local institution, what's feasible at your local institution, because not everywhere can suddenly refurbish their dialysis unit to provide central acid delivery because of cost considerations, for example. So it's a question of prioritizing what's possible locally. But I think with that, it comes the framework of who can be involved and who isn't, who has the ability to be involved, that can then make that happen. So no, to your point, I don't know of a place that has, there's no one place to my knowledge that has it all.
Am I allowed a follow-up question?
You are, go ahead.
How can we get one place to do it all? What I mean is that for me, I think that it absolutely is possible, whether it be a GP practice, a renal unit, a hospital. I think that between the people who are here and the people that we know, we absolutely could get it absolutely perfect. A beautifully low environmental impact, high quality for patients, preventative service. And for me, I want to go and visit that place. I want to go and visit that, not necessarily shiny, but that, green facility and service provider that is able to say, well, actually, you can do it too. So it's it's almost, how can there be a pilot of something which really is shiny, which really is innovative and really can do it? Because sometimes I think it looks great on paper, or it's great theoretically, but the demonstration of I can go and touch the walls and I can speak to the staff and the patients, and they're really excited and keen because they've got it all. So I guess the next question is, how do we move from to having somewhere that really is truly at the absolute cutting edge?
This sounds like a challenge, and a good one for many of us. It's a question of getting people on board. It's a question of working at all aspects together, promoting these local QI initiatives, keeping track of them, engaging the members of the division, either at a local level or certainly provincially. And I think provincially is also where many of the bigger procurement decisions can be made. And I think it's working at all levels in parallel where we'll get there.
Thanks, Caroline.
I just wanted to expand on that. Thanks so much, Tamara. It's an amazing overview. And Matthew, you've got me thinking there, because it's, I agree with Tamara that probably here in BC, we're the furthest ahead. And I think, why is that? That's because we've got a provincial work. Actually, I'll back up. It's because we did an exercise saying what are our priorities in our community. And that exercise identified environmental sustainability as one of those key priorities. So others were patient-focused care, various other quality improvement initiatives, and prioritizing Indigenous access to healthcare. So this became part of who we are and what we do. And I think that was really, really, really key. The other thing is, we're lucky within BC to have a lot more climate infrastructure. And so our government has Clean BC legislation. The Ministry of Health, as a major player in the government, has their decarbonization and environmental targets. And so that had a trickle-down effect through healthcare. And so these things lined up at the right time. So I can't stress enough, I usually start most of my talks with what your requirements are, your sort of legislative requirements. And so I think we were really lucky here in BC. And then we also benefit from the network. We've got administrators that are involved. We've got payers that are involved. And then you can show them the work that not yet us had done, but a lot of you on the call today, and people who put those case studies in and how you save money, that gets the administrators excited and gets them on board. And so I think we're nowhere near perfect, but I get excited now every day. And I keep going back to hemodialysis unit, but we haven't really talked about the fact that this is not just a hemodialysis initiative. And so when we're working to get this grand decarbonization plan, and we've got different tentacles going everywhere, trying to get the data and trying to get plans of how we can do that. This is where all those BC renal communities come in. The transplant people come in. The home dialysis people come in. Yes, the hemodialysis committee comes in, but the administrators group come in. So it's kind of prioritizing for everybody what their tasks are. So we're having our moment now, and I hope it lasts. I hope it's not just a moment. I hope that it really trickles down into changing how we do things. But we've got a emulated after the Green Nurse project that was a case study that was written up on the Centre for Sustainable Healthcare Resources. We've got a locally funded project of a nurse who's going through our hemodialysis unit, and it is so exciting. It's every day there's different implementation things. There's communication that happens between people who work, on that floor, and all the staff is getting really excited. So it just seems to be the right, the macro, meso, micro involvement in how these different parts can talk together.
That's wonderful. Thanks, Caroline. Rachel.
Sorry, my camera's up. Hi, Tamara. I'm Rachel. I also work at Centre for Sustainable Healthcare with FRAT. I was just thinking after Matt's comment about there's so many different changes and, is there a place that's doing it all? And I guess a different way of thinking about that is there one change that every place is doing as a way of scaling as well? So it's more of a comment than expecting you to answer that. And then separately, a piece of work we're hoping that we might be able to look at in a project is the central acid delivery, like you've mentioned, and how we can improve sustainability of that. So I'd be keen to learn more about the steps you've taken so far. I think you mentioned engagement with your suppliers, but if you've done some work around identifying the barriers or enablers that you might have locally to you, but potentially across Canada as well. You also don't have to answer this right now, but anything that you can share with us, more information would be really helpful.
Why don't I send along some resources? Actually, so here in Ottawa, it used to be the way that it was done here, and it's been this way for some time. So in some ways, we have the benefit of it already having been done this way for 20 years here. And the same is true across a number of institutions. And so the barriers are less because the infrastructure was already there. And so then in the planning of a new hemodialysis unit, it was an automatic that it was going to be done this way because it would have seemed odd to go back the other way. So part of that is institutional comfort, I would say. Now there are a number of publications that have looked at the central acid delivery being implemented as a new thing. So I can find those and send them along to FRAT to disseminate.
Amazing. Thank you.
I've got a question following the discussion just from a moment ago regarding the priorities set within or with communities. And it sounded like that really enabled or formed a mandate to then go and do some of these changes. So I'm really keen to hear more about that process.
Maybe I can just make a quick comment about some of the research priorities that are being done. Look, at Dr. Sandel's working on resilience and adaptation, and Dr. Itzi is looking at the perspectives of patients and providers. And I think that it's exactly what we need to focus on, to figure out what are the priorities of people, not just healthcare providers, because I think without engaging patient partners or figuring out what are the priorities from a patient level, whether that's for home dialysis or hemodialysis or transport or otherwise, those are the key things to think about that will really bring the most engagement. So to your point, we're working on it. And I think having patient partners, whether it's at our local level or at a national level on our committees, will be really helpful to not miss any voices or have any gaps going forward. One part where I think that we're working on is the inclusion of Indigenous voices, because the Southern programs also provide much of the care for the North. And so not missing that as a very important perspective of how we deliver care is invaluable.
Thank you. Duca.
Yeah, hello. I'm also from the Centre for Sustainable Healthcare. Just following on from that patient views of sustainability issues, I'm wondering if you've seen any work that relates to engaging directly with nature as part of this sustainability agenda.
Good question. I don't know if anyone else does. So engaging directly with nature. We can sign up as healthcare professionals in Canada as prescribers to Parks Canada to provide free passes for people to go out to parks, to where they otherwise would have had to pay for an entrance fee. That's the only example that I can think of. I don't know if anybody else has any knowledge in this regard.
Maybe got time for one, possibly two more questions. So we'll just leave it open to the floor for a moment. Question from Eleanor Murray coming in the chat, which is, how do you think we coordinate internationally?
So it's a good question. And I think Dr. Stigant would probably be better positioned to answer that one, having been involved on the steering committee of KDIGO. Coordinating internationally, I think first comes along from having a guiding document and a guiding set of principles, a guiding set of research priorities, of gaps, of what it is that we could and or should be focusing on, and bringing key leaders from the different areas together. I also think coordinating internationally doesn't have to come, can come at us on a smaller scale. Figuring out initiatives that are being done in one spot, speaking to someone who works in a different country, and then starting small, but and then bringing the initiatives that are done not necessarily in the same fashion together. That's certainly another way of doing it. But I think having the support of KDIGO, having this guiding document is invaluable in trying to coordinate, and also providing weight to what it is that we want to focus on.
Go ahead, Caroline.
Yeah, I just wanted to add to that. I think the Sustainable Kidney Care Network. I'm tooting your horn here, Farat and colleagues, because it seems to be like a growing central repository. I think there's over 600 people signed up to that. So Green K, like we're rolling out with podcasts, and we've got a toolkit, implementation toolkit coming up, and various other resources, and Frances and her group, and Kit New Care, of course, tremendous resources coming up, but it seems to be kind of a common link. So I'm hoping that we can keep that as sort of a global notice board, and you get these inbox reminders about collaborating or different ideas, and it's fun to get those emails and see what other people are doing. So I'd say keep that going, and let's share that contact with our friends too. Yeah.
Thank you for that. Yeah, couldn't agree more. And it's nice because it's obviously it's asynchronous and people can dip in and check it out as and when, and then able to take meetings like this with people from all over at the same time allows us for that face-to-face, albeit digital communication as well. Time for, I think, one last question. If anybody speak now, forever hold. Shugri, go ahead.
Hi, I just have a quick question. So I'm asking just from a sustainability perspective. I'm curious if many of the listeners here still work in an area where they do daily dialysis. I used to work at a unit that used to do daily dialysis, and I always thought from like a sustainability perspective, doing 2-hour treatment 6 days a week for a lot of patients can be quite intensive from a carbon perspective. And I'm just curious if there are any areas that are rolling back on this practice or are still continuing to do this type of practice.
It sounds like that's a no from probably most of our listeners.
Couple of answers coming in chat. So it seems like only when it's absolutely needed. If I can sneak one last question in. You mentioned towards the beginning longitudinal sustainability materials. Apologies if this is a big or an open question, but I was really curious just to sort of understand a little bit more about what that looks like.
Do you mean the educational materials?
Yeah.
Yeah, so in terms of longitudinal material, well, right now, do you mean from the Royal College standpoint or from
Sorry, it was one of the earlier slides, and it was about how part of the initiative was to introduce longitudinal materials. I didn't make a note of where that was from. Apologies.
Yeah, no. So I think what you're talking about is the medicine program here, and it's led by one of the internists, is really has tried to go away from it being a siloed entity, planetary health or sustainability, because if we keep it in a siloed way, it may reach fewer people. It may be a lecture that's delivered once every 2 years that people then may not attend, that they may not think of as something that we can incorporate into our daily practice, that should be within everything that we do otherwise. And so they thought of an alternate way of trying to reach people, was to incorporate it into all of the lectures that are provided at their internal medicine half days. There's a fantastic student resident who's working on this, and it's really to getting people who are interested in the topic to provide just a few slides, just, this is why it's important. What can we do aimed at internal medicine residents, really to take away something incredibly pragmatic to their training or to their clinics or inpatient service, and say, here are the few little things that maybe I can think about. Sick day rules, meter dose inhaler, just small things that add up, and little tidbits that they can take away that are in the context of whatever it is that they're learning about. So that's in the works right now, and I very much hope it'll be well taken. And I certainly think it will be, because I think also with the Royal College, again, trying to incorporate this in a longitudinal way that is part of everything in terms of assessments, in terms of training, in terms of how it is that we should be thinking of this within different specialties. I think that's probably the way that we're going to be going in the future. Fantastic. Yeah. How great. Well, on that note of sustainability as a theme that runs through all we do, I think what a lovely note to end on. So Tamara, I just want to thank you once again for the brilliant presentation, giving us your time, taking questions. It's been a real pleasure and privilege to have been part of this webinar and to facilitate it. We run these every month on the 4th Thursday from 2 till 3 UTC. If anybody in attendance is interested in presenting or knows somebody, do reach out, because we have a couple of spots left. And really, it's just about hearing from experts and learning and facilitating that cross-learning in a community of practice. So it really is a privilege to be able to do this. We will put a recording of the video up on the network, which Caroline very kindly plugged for us. And that can then be sent around to people if they weren't able to be here. And wishing everybody a great rest of your day. Thank you all.